Part 4 in the series, The Diabetic Eye. Good evening. This is number 4 in our series on the diabetic eye, and this is an important one. Tonight we get into the retina, into diabetic retinopathy, and in all of these videos, one thing that I'm trying to do is stress the importance of getting a regular yearly dilated eye exam. It's important that your eyes be dilated. That's where we put drops in your eyes to open the pupil up so that we can see the inside of your eye better, see the retina clearly. And tonight we're getting into that topic of diabetic retinopathy. So I want to emphasize the importance of a yearly diabetic dilated eye exam. And it's extremely important for catching anything going on in your eye early. Also, my whole channel is dedicated to the idea, basically to my own story of lowering my A1C from dangerously high level of 9.9 to a super safe level of 4.9. From 9.9 to 4.9, I did that in about just a little over 4 months. And I'm really trying to encourage everyone to take their diet and their nutrition seriously and realize that there is something that you can do about it. You can have hope that you don't have to just sit back and wait for all these terrible things to happen. They don't have to happen to you at all. I hope that none of these things ever happen to you. And also to encourage that if you've had any of these things start occurring, there are treatments for all of these things, except some of the really, really bad end stage problems. But we haven't discussed anything yet in these 4. This is the 4th in the series, but in the first 3, all of the things we discussed there can be treated and taken care of, and much of it can be taken care of just by improving your diet. Main thing is to lower those carbohydrates, get them as low as you possibly can, and so anyway, let's get on with diabetic retinopathy. Extremely important topic. When eye doctors talk about diabetic eye problems, this is the first thing we think about is diabetic retinopathy. The first 3 videos covered other issues that we also have on our checklist of things that we're going to check during a comprehensive eye exam with a diabetic. But this is the first thing we think of is diabetic retinopathy because this is where it really gets critical, where it really gets important. And so anyway, the retina, of course, is the back portion of the eye. So far in the first few videos, we had been focused on the front part of the eye, but now we're going to go to the back part of the eye, to the retina. That's where all the delicate nerve tissue is and very delicate blood vessels. And, if you know very much about diabetes, you know that little delicate blood vessels can be adversely affected in diabetes. And so that's what concerns us. You have all these little delicate nerves in the back of the eye, and then you have little delicate blood vessels that feed and nourish those little nerves. And if anything happens with those blood vessels, we've got a problem because that can cut off the nourishment that these nerves need, and that can lead to blindness ultimately. And so anyway, the causes of diabetic retinopathy, of course, is diabetes, or blood sugar that's out of control. Since we're talking about trying to really control our blood sugar, I want to make that point that this is not inevitable for all of us that have been diagnosed with diabetes. We can avoid many of these problems by getting our blood sugar under control. And there are ways to do it with diet. There definitely are. And that's my story. That's what I did. But anyway, one of the complications of diabetes is weakening of little tiny blood vessels in all parts of the body, really, like the feet and kidneys, and but we're concerned with the eyes here. That's my specialty. And these little small blood vessels inside the eye can become weak and become damaged. And when that happens, then the next step will be that new blood vessels will begin to form. Little small new blood vessels that are even more fragile will form to try to supply the nutrition and oxygen that the nerve tissue in the eyes need. And then those blood vessels are even more fragile, and they can begin hemorrhaging and causing all sorts of really serious problems in the eye. And so the early stages of diabetic retinopathy are called non-proliferative or background. Sometimes it's referred to as background diabetic retinopathy. And that early stage really doesn't have much effect on your vision. The only way you're going to know that you have that early stage is to be getting your eyes examined every year. And we're going to dilate your eyes, and we're going to look for those early changes like that. So it's very, very important to get your eyes checked every year and to have them dilated when you get them checked. The more advanced stage of diabetic retinopathy is called proliferative. That's when you have all these new blood vessels being formed and that sort of thing. And that is a much more dangerous problem. And there are vision problems associated with that, such as cloudiness or distortion or loss of central vision. Blind spots, floaters may appear. Some of these symptoms occur in other types of eye problems too, but with a diabetic, if you're noticing those symptoms and it's been a while since you had your eyes checked, you better get in there quickly. There are treatments for diabetic retinopathy, lasers and things, but the quicker you can get it looked at, the better, because the better the outcome will be if it can be treated quickly. Okay, I'm going to show you some pictures of the first two pictures I'm going to show you are posters similar to this one, but it's a different poster that we have in our office in the exam rooms that first show what a normal retina looks like, and then what a retina with diabetic retinopathy looks like. And the ones off of a poster similar to this, the normal retina looks pretty normal, but the diabetic retinopathy picture that they show on that poster is pretty horrific looking. I've never seen a retina that looked that bad. For one thing, there's a number of different manifestations or problems that you can see in a retina that has diabetic retinopathy. That particular artist's rendering, that particular drawing, shows them all on one retina. I've seen each of those individual problems in different retinas, but I've never seen all of them in one retina, and I don't know that anybody has. But then I'll move to a different artist rendering that's very much more simple, and actually, is probably a little more reasonable to look at. And again, I'll first show you a normal retina, and then show you an artist rendering of diabetic retinopathy. Again, that one's very much more reasonable. And then the last graphics I'll show you are actual photographs of someone with diabetic retinopathy. And that'll show you what it really looks like when we look into the eye. And when we in our office, we have a digital camera where we take photographs of the retina and store those so we can refer back to them and look for subtle changes from time to time and all that. And the last images I'll be showing you will be those actual photographs rather than artist renderings. But this will give you an idea of what we're talking about when we talk about diabetic retinopathy. Look at these images. Okay, so this is the poster I was talking about. This is showing what a normal retina looks like. And this is this horrific diabetic retinopathy picture that an artist drew. And again, I've never seen one look that bad. This is another artist rendering of the normal retina. This is pretty good representation of a normal retina. Now this is a drawing of a diabetic retinopathy that looks fairly reasonable. And then this is an actual photograph of diabetic retinopathy. And this is what we see when we look into eyes. These are actual physical photographs, and this is pretty much what it looks like. Again, that shows you what diabetic retinopathy looks like. It shows you sort of what we're looking for when we look at the retinas to determine if there's any damage like that there. And but I want to emphasize that it is definitely possible to help avoid these kind of issues. Number one, by getting your eyes checked every year, and then the things you can do on your own at home is try to keep that blood glucose under control the best you can, and diet, in my opinion, is the very best way to do that, to really keep those carbs as low as you possibly can. Use some intermittent fasting like I did, and you can have great success. You can really overcome and avoid all of these issues. And that's, I really want to be an encouragement to you. Sometimes you start looking at all these things that can go wrong with your body from diabetes. It can be very discouraging. That's not my intent. My intent is to motivate you to take control and not just sit back and wait for things to happen to you. Take control, prevent these things from happening. It's very doable. That's my story. That's what I've done. And that's what I want to encourage you to do. So we'll end for tonight. There's definitely going to be one or two more videos in this series because we've got to go on to discuss the macula of the eye. The macula is the very central part of the retina. We just kind of, in general, discuss diabetic retinopathy tonight. We're going to go to diabetic macular edema next. That can be pretty devastating to your vision. So that'll be our next topic. And then I may do one more video on, as kind of a wrap up, or may even get into macular degeneration, which is not an exclusively diabetic. It's not really, doesn't really fall in there in that exclusively diabetic type eye problems. But it is, macular degeneration is a big problem. But the next video will be on diabetic macular edema, which is a big diabetic problem if you allow it to be. So anyway, remember, live healthy, finish strong, and you can do it, I promise.